Have you ever felt that something was off with your body but brushed it off, thinking it was nothing? We're all guilty of ignoring those little aches, pains, or weird symptoms sometimes. Maybe you're tired all the time, but hey, who isn't these days, right? Or maybe you've noticed your hair thinning a bit, but you tell yourself it's just stress. Listen up, because today we're talking about 5 body warning signs you should never ignore. These are subtle clues your body might be trying to tell you that something needs attention. We're talking about those signs that could seem like no big deal at first, but could potentially point to something more serious. We've all experienced fatigue, that feeling of being completely drained. But when does feeling tired cross the line into something more concerning? If you're constantly exhausted, even after a good night's sleep, your body might be trying to tell you something's up. This constant fatigue can manifest in many ways. You might find it difficult to concentrate, feel sluggish throughout the day, or lack the energy to do the things you enjoy. Sure, lifestyle factors like stress and overworking can contribute to fatigue, but persistent exhaustion could be a sign of something more serious. Conditions like thyroid disorders, anemia, or even sleep apnea can lead to persistent fatigue. Ignoring this sign could mean ignoring an underlying medical condition that needs addressing. If you're constantly hitting the snooze button and dragging yourself through the day, it's time to listen to your body. Don't just mask the fatigue with endless cups of coffee. Address the root cause by scheduling a visit with your doctor. They can run tests to rule out any underlying medical conditions and help you get to the bottom of your exhaustion. Remember, your health is an investment, not an expense. Noticing more hair than usual on your brush or in the shower drain? Hair loss, especially when it's sudden and unexplained, can be alarming. While it's normal to lose some hair every day, excessive shedding could point to an underlying issue. Hormonal imbalances, nutrient deficiencies, and even stress can disrupt your hair growth cycle, leading to hair loss. For example, thyroid disorders, often associated with hormonal imbalances, can significantly impact hair growth. Similarly, deficiencies in essential nutrients like iron, vitamin D, and biotin can also contribute to hair loss. Now, before you panic, remember that not all hair loss is a cause for major concern. However, it's crucial to pay attention to your body and seek professional advice when needed. If you're experiencing sudden or excessive hair loss, don't hesitate to consult a dermatologist or your primary care physician. They can help determine the underlying cause and recommend the appropriate treatment options. Remember, addressing hair loss early on often leads to better outcomes. And the appropriate course of action. Ever feel like the room is spinning, even when you're standing still? Or maybe your vision blurs suddenly, making it difficult to focus. These episodes of dizziness or blurry vision, while often fleeting, can be incredibly disorienting and even frightening. While they're usually harmless and pass quickly, frequent or persistent dizziness and blurry vision could signal an underlying health issue. Low blood pressure, for instance, is a common culprit behind dizziness, especially when standing up too quickly. On the other hand, high blood sugar levels in diabetes can also lead to blurry vision. Even dehydration, something as simple as not drinking enough water, can leave you feeling dizzy and lightheaded. In some cases, these symptoms might point to more serious conditions like inner ear problems or neurological disorders. The key is to pay attention to your body's signals. If you experience frequent or severe episodes of dizziness or blurry vision, don't dismiss them as simply feeling under the weather. Consult your doctor to rule out any underlying medical conditions and get the appropriate treatment. We all experience the occasional digestive woes, indigestion, bloating, constipation. But when these digestive discomforts become a regular occurrence, it's time to listen to your gut, literally. Changes in your appetite or digestion can signal a range of underlying issues. Persistent stomach pain, for example, could be a sign of gastritis, ulcers, or even irritable bowel syndrome. Similarly, sudden changes in bowel habits, such as constipation or diarrhea, could indicate a problem. While these symptoms are often associated with digestive disorders, they can sometimes be early warning signs of more serious conditions. Inflammatory bowel diseases, like Crohn's disease and ulcerative colitis, often manifest as persistent digestive problems. Changes in appetite, particularly a sudden decrease in appetite or unexplained weight loss, can sometimes be a red flag for certain cancers. The takeaway here is simple. Don't ignore your gut feelings, both literally and figuratively. If you experience persistent or concerning changes in your digestion or appetite, consult your doctor. They can help determine the cause of your symptoms and recommend the best course of action to get your gut health back on track. So there you have it, 5 body warning signs you should never ignore. Remember, your body has a remarkable way of communicating its needs. These signs and symptoms are its way of telling you something might be off. Ignoring them is like hitting the mute button on your body's alarm system. If you've noticed any of these signs, don't ignore them. Talk to a doctor. Early detection is key when it comes to managing health conditions. Schedule that checkup, get those tests done, and most importantly, listen to your body. Like, share and subscribe for more health content.